The lump appeared 3 weeks after my 28th birthday. Small, hard, unmovable in my left breast. I was a software developer at TechCore Solutions, healthy with no family history. Cancer wasn't on my radar. Stage 2B invasive ductal carcinoma, Dr. Helena Martinez said, showing me the biopsy results. Aggressive. We need immediate treatment. Chemotherapy, double mastectomy, then radiation. Without it, survival rate drops significantly within months. The cost after insurance was $90,000. I'd need 9 months of intensive treatment. I called my parents that night. Both worked at Riverside Medical Center. Dad as a hospital administrator, Mom as head of medical records. My brother Tyler was a physician assistant in their ER. Medical family. They'd understand. Cancer. Dad's voice was skeptical. Chloe, you're 28. Breast cancer at your age is extremely rare. Are they sure it's not a cyst? I had a biopsy. It's definitely cancer. Stage 2B. Long pause. That's borderline. Could be managed conservatively. Who's your oncologist? Dr. Helena Martinez at Metropolitan Cancer Center. Never heard of her. Metro isn't top tier. Come to Riverside, get a second opinion from someone we know. Dad, I've started scheduling. These community oncologists overtreat to cover themselves legally. Wait, get more opinions before jumping into aggressive treatment. Mom got on the line. Your father's right. Cancer treatment is harsh. Maybe monitor it first? See if it grows. It's already growing. Dr. Martinez says it's aggressive. At your age, your body is strong. You might not need all that treatment. Chemo is brutal. You'll lose your hair, be sick constantly. Are you sure? My hands shook. I have cancer. Without treatment, I could die. Doctors say that to scare people. Look, we're planning a family vacation in August. 3 weeks in Europe. Tyler's finally getting time off. Can you schedule treatments around that? We've already put down deposits. My surgery is tentatively August. Can't you push it to September? We've been planning this for a year. I have cancer. Stage 2 borderline, Dad corrected. Not an immediate death sentence. A few weeks won't make a difference. Let's discuss at our family meeting next week. The meeting was at their house the following Sunday. Tyler showed up in scrubs, fresh from a shift. So you think you have cancer? He said, not greeting me. I know I have cancer. I have the pathology report. Let me see. He skimmed it. Okay, so it's cancer. But stage 2B is very treatable. You're probably overreacting to what the oncologist told you. She said I need aggressive treatment. She's covering her ass. I work in emergency medicine. I see real cancer emergencies, stage 4 metastatic disease, people dying. What you have is early. You could probably do lumpectomy, maybe skip chemo entirely. My oncologist specifically said. Your oncologist wants to bill insurance for maximum treatment. That's how oncology works. Dad nodded. See? Tyler understands the medical business. Get a second opinion at Riverside before deciding. And really, we need you flexible about timing. This Europe trip is important for family bonding. I have cancer. Early stage cancer that's manageable, Mom said. Let's not blow this out of proportion. You've always been a hypochondriac, sweetie. I started documenting everything after that. Every dismissive comment, every text minimizing my diagnosis, every email prioritizing vacation over treatment. I kept all medical records, pathology reports, treatment plans, research papers on my cancer subtype. What they didn't know, Metropolitan Cancer Center was being acquired by Riverside Medical Center. Dr. Helena Martinez had been hired as the new chief of oncology for the entire Riverside system. My family's new boss in 3 months. Build-up. Treatment started despite objections. First chemo left me violently ill for 3 days. I couldn't work, could barely eat, lost 12 pounds in 2 weeks. Dad called once. How are you feeling? Terrible. The chemo is brutal. Well, you chose to do it. Tyler and I still think you're overtreated. Anyway, we finalized Europe, August 8th through 29th. Schedule your surgery after we get back. My surgery is August 15th. Dr. Martinez says we can't delay. This is ridiculous. We paid $15,000 for this vacation. Can't you explain to your doctor that you have a family commitment? I have cancer. That's my commitment. Early stage cancer that's not immediately life-threatening. Be reasonable. Mom texted, "Your father is stressed about the vacation conflict. Can you work with Dr. Martinez on timing? Tyler says August versus September won't make a real difference." I showed the text to Dr. Martinez. "Your family works in healthcare?" she asked, expression darkening. "Dad's a hospital administrator. Mom runs medical records. My brother's a PA in emergency medicine. And they're telling you to delay cancer treatment for a vacation? They think stage 2B isn't serious enough to warrant this level of treatment." Dr. Martinez pulled up my scans. "Chloe, your tumor has grown 8 millimeters since diagnosis. It's hormone receptor negative, HER2 positive, aggressive subtype. You need surgery as soon as possible. Waiting could allow metastasis. Can you put that in writing?" "Of course. Why?" "I'm documenting everything. I need evidence this is serious and time-sensitive." "What hospital do they work at?" "Riverside Medical Center." Her expression shifted. "Riverside. I see." She didn't elaborate. "My family went on their Europe vacation during my 4th and 5th chemo sessions. I was alone, sick, terrified." Tyler posted photos from Paris. "Family time is the best time." I wasn't tagged. When they returned, Mom called. "How are you? Sorry we couldn't be there, but this trip was planned so long. I had 2 chemo sessions alone. But the nurses were there. That's what they're paid for. Your surgery is next week. We'll try to visit if we can." The double mastectomy happened August 15th. 6 hours of surgery. I woke up in pain, bandaged, alone. Dad visited for 15 minutes 2 days later. "You look good. You're handling this fine. I still think you could have skipped the double mastectomy, but what's done is done." Dr. Martinez said it was necessary because of tumor characteristics. "She's covering herself legally. But you're through the worst. Radiation should be easy." "Radiation is 6 weeks, 5 days a week. Right, but it's just lying under a machine. Not like chemo. You'll barely notice it." I started back at work part-time during recovery, exhausted and in pain. They were planning Thanksgiving. "Big family dinner at our house," Mom announced. "Tyler's girlfriend is coming. We want you there looking healthy and happy. No cancer talk. Everyone's tired of hearing about it." "Everyone's tired of hearing about my cancer? It's been months of cancer, this, treatment, that. Let's have one nice gathering where we focus on being grateful. Wear something that hides the surgical scars. We don't want to make people uncomfortable." 2 weeks before Thanksgiving, the Riverside merger finalized. The announcement went to all staff. Dr. Helena Martinez was now chief of oncology for the entire Riverside system, overseeing all cancer services and medical staff. I saw it. I said nothing. Revelation. Thanksgiving dinner was at my parents' house. 20 people, Dad holding court about hospital politics, Tyler discussing ER cases, Mom fussing over turkey. I sat quietly, exhausted from radiation. "Chloe's looking so much better," Mom announced. "She had some health issues earlier this year, but everything's resolved now." "Health issues?" My aunt looked concerned. "What kind?" "Just routine checkups," Dad said quickly. "Everything's fine." My uncle pressed. "Chloe, are you okay?" Tyler jumped in. "She had a minor cancer scare. Stage 2, very early, very treatable. She did some treatment and now she's good." "Cancer?" My aunt looked shocked. "That's not minor. Stage 2 is basically not serious," Tyler said dismissively. "The oncologist probably overtreated, but Chloe wanted to be aggressive. It's done now." Dad nodded. "We tried to tell her she could have done less, but you know these community doctors. They scare patients into overtreatment." I set down my fork. "I'm still in radiation. 5 weeks down, 1 to go." "Right, but radiation is nothing," Tyler said. "You just lie there. Hardly counts as real treatment." "And your surgeon was overly aggressive," Dad added. "Double mastectomy when lumpectomy would have been fine." My cousin, a nurse, spoke up. "Wait, you had breast cancer and they're calling it minor? What subtype?" "HER2 positive, hormone receptor negative," I said quietly. Her face paled. "That's one of the most aggressive types. And you're only 28? That's incredibly serious." "It's stage 2, Tyler said dismissively. "Not stage 4. Big difference." Stage 2 HER2 positive is still high risk, my cousin said. Especially at her age. Who's her oncologist? Some doctor at Metropolitan Cancer Center, Dad said. We offered to get her into Riverside Oncology, but she insisted on this community doctor. Metropolitan, my cousin said. Isn't that the facility that just merged with Riverside? The room went quiet. The new chief of oncology at Riverside came from Metropolitan, my cousin continued. Dr. Helena Martinez. She's a big deal. Published tons of research on aggressive breast cancer. Brilliant but very strict about evidence-based protocols. I watched my father's face change. Chloe, he said carefully, who's your oncologist? Dr. Helena Martinez. The color drained from his face. The Dr. Helena Martinez? My cousin pulled out her phone. The one who just became chief of oncology at Riverside? Oh my God, you're being treated by one of the top breast cancer specialists in the region. Tyler's girlfriend looked confused. If your family works at Riverside and your oncologist is now chief of oncology there, why were they saying she's just a community doctor? Because they never asked her credentials, I said quietly. They assumed she wasn't qualified and spent 8 months telling me she was overtreating me for profit. Dad stood abruptly. Chloe, can we talk privately? No. We can talk here. You knew about the merger, Mom said, voice shaking. I saw the announcement 2 weeks ago. And you didn't tell us? You didn't ask. Just like you didn't ask about my treatment, surgery, or how I was doing during chemo. You were too busy planning vacations and telling everyone my cancer was minor. Tyler's face was red. Dr. Martinez is now my boss's boss. She oversees all oncology protocols in the hospital. I know. Did you tell her what we said? I showed her the texts. Where you said stage 2B wasn't serious. Where Dad said she was treating me for profit. Where Mom asked me to schedule surgery around your vacation. The room was silent. Why? Dad whispered. Because I was documenting my cancer treatment and my family's response. Dr. Martinez asked why I had no family support during chemo. I showed her the evidence. My cousin stared at her phone. Dr. Martinez published a paper last year about family dismissal of young women's cancer diagnoses. She's known for taking that issue really seriously. She's also known for zero tolerance for medical staff who demonstrate poor clinical judgment, my cousin's husband added. Healthcare workers should be held to higher standards. Dad sat down heavily. Mom was crying. Tyler looked sick. Department reviews start next week, Dad said quietly. Dr. Martinez meets with all senior administrators to assess operations. I'm sure it'll be fine, I said flatly. Just explain that you thought stage 2B HER2 positive breast cancer was minor. That you prioritized a vacation over my surgery. That you told everyone my cancer was a routine checkup. I'm sure she'll understand. Resolution. The first review was the Monday after Thanksgiving. Dr. Martinez met with administration including my father. She brought my file, complete with medical records, treatment timeline and documented family responses. Mr. Preston, she said, I understand your daughter Chloe is my patient. Yes, we didn't realize you were. You didn't realize I was qualified? Despite training at Johns Hopkins, publishing over 40 papers on breast cancer, and practicing oncology for 15 years. Metropolitan seemed like a community center. Metropolitan is one of the top breast cancer facilities in the state. But that's not the issue. The issue is you, a hospital administrator, told your daughter stage 2B HER2 positive cancer was not serious. You encouraged her to delay surgery for a vacation. You called evidence-based treatment overtreatment for profit. I didn't understand. You work in healthcare. You have access to medical databases. You could have researched her subtype. Instead, you dismissed her diagnosis, minimized her suffering and went to Europe during chemotherapy. He was placed on administrative review. His judgment questioned. His ability to oversee patient services challenged. Tyler fared worse. He told colleagues his sister's minor cancer was overtreated. When Dr. Martinez implemented new protocols, she learned Tyler had been telling your staff that stage 2 breast cancer didn't warrant aggressive treatment. You told colleagues that stage 2B HER2 positive disease isn't serious, she said in a documented meeting. How many patients in this ER have you dismissed because you don't think early-stage cancer requires urgent intervention? Investigation revealed multiple instances of him dismissing patients' cancer symptoms as not serious enough. His suspension became termination. Mom faced scrutiny for having access to my files and still calling my diagnosis a routine checkup. Privacy implications aside, dismissal of documented malignancy by someone who should understand medical terminology was damning. She was demoted to clerical work with no patient record access. All three had their Riverside careers effectively destroyed within 2 months. Dad called once. "You ruined our lives." I documented my cancer treatment. Dr. Martinez made employment decisions based on demonstrated poor judgment. "We're your family. You went to Europe during my chemo. You called my cancer minor. You told me my oncologist was overtreating me. She's now your boss and saw all of it. You could have warned us. You could have supported me during cancer treatment." None of them have spoken to me since. The story spread through Riverside. Everyone knew about the family who dismissed their daughter's aggressive breast cancer, only to discover her oncologist was their new boss. "Healthcare workers should know better," a nurse told me at follow-up. "If your brother was dismissing his sister's cancer, how many patients did he do that to?" 6 months post-treatment I was cancer-free. Dr. Martinez continued monitoring for recurrence. "What happened with your family's employment wasn't revenge," she said. "It was about patient safety. Staff who demonstrate that level of poor judgment are a liability." "I understand. You did nothing wrong." Many young women face dismissal of their cancer diagnoses. Your case highlighted a serious issue in healthcare culture. "My family spent 8 months telling me my cancer wasn't serious, that I was overreacting, that I should plan around their vacation. They did this while working in healthcare, capable of understanding what HER2-positive disease meant. They chose convenience over my survival. They chose vacation over my surgery. They chose assumptions over medical evidence." Dr. Martinez didn't destroy their careers. She evaluated whether staff who demonstrated profound poor judgment should remain in positions of medical authority. The answer was no. I'm 29 now. Cancer-free, working full-time, rebuilding without family support. My treatment was aggressive, evidence-based, and necessary. My oncologist was brilliant, qualified, and compassionate. My family's careers ended because they dismissed documented cancer, then discovered that patient's oncologist was their new boss. They made choices. They just didn't expect professional consequences. The medical records don't lie. The pathology reports don't exaggerate. The treatment protocols were evidence-based and appropriate. And unlike my family's opinions, peer-reviewed oncology research doesn't care about vacation plans.